There may be a 10-year-old who will come in with a fracture that's been caused by his own mother. There are children, like a 7-year-old, who will come in and disclose sexual abuse by an uncle. And the worst thing that can ever happen is that then we sometimes will see a parent who doesn't believe their child's disclosure and refuses to keep that child safe. It's very typical of Hasbro Children's Hospital to be leading the way. The Aubin Center is the only place in all of Rhode Island that has the expertise to provide medical evaluations for child abuse and neglect.
20 years ago, we discovered that there was a real need for child protection in the state of Rhode Island. And it really wasn't a problem that people want to discuss or talk about. We decided to take the challenge on to help solve the child abuse problem in the state of Rhode Island. And these children aren't able to speak for themselves. So basically, that's why people like us have to get up and speak for them.
Those children are referred to us sometimes directly from their parents, sometimes from their primary care physicians, sometimes from the emergency department, DCYF, or law enforcement.
It's such an important part of what we do is to make an environment that is child-centered, where the child feels like this is an adult that can handle what has happened to me, even if it's the worst thing possible.
For me, the most difficult part is when a child is so fearful of their own caregivers. And we actually work very hard in supporting that child and their safety while they're here in the clinic and after they leave the clinic. Into your heart. Do you know where your heart is?
I see patients who have very serious injuries, who have been really horribly sexually abused. The patients who have no one in this world at all, who have been neglected, who have essentially been abandoned by all of the adults, those are the kids who I go home at night thinking about.
I hear really horrendous things from children. I think the hardest thing about any of them is to hear in a child's own voice what has happened to them.
This drawing was done by a child who came to the Aubin Center for an evaluation. He drew this bird. One of its wings is broken, and it is still able to fly. And then we asked him to draw this other picture of himself, and this is what he drew.
When we've made a diagnosis of abuse, whatever form that is, we start making calls. We start talking to people about how to keep that kid safe and also how to keep other kids safe who might have contact with those perpetrators.
When we evaluate children, we have the expertise to identify when abuse is occurring and when it is not. And it's unfortunate that not every child can be seen by us because we have limited resources. Without that specialized training, there are in fact several cases where injuries have been missed. And the hardest thing for me is when I see a child who has a missed, inflicted pattern injury that I know if that child had been seen at the Aubin Center, we would have known and identified immediately that that was an inflicted injury. And instead, several of those kids have returned home only to be re-injured. Additional funding is vitally important to be able to actually hire another child abuse pediatrician that will allow us to see those children when there's allegation of abuse or neglect, instead of having them go to the emergency department or urgent care where their evaluations will not be as complete and sometimes not accurate.
I was honored to have the Child Protection Program named after me, but the biggest honor that I would have in my life would be if we could take the sign down and we didn't need Child Protection Program any longer in this country.
Mommy, I was safe here in the hospital. They treated me good, feeded me good, and most of all, taking care of me good.